Welcome to Talk with Healthcare Heroes episode 9 presented by Medical Crib. Today I have with me Dr. Swasti, who's a senior consultant gynae oncologist at Max Vaishali and Max Patparganj. Today we'll be talking about uterine cancer. What is uterine cancer? What are the risk factors to it? What are the symptoms that we see in uterine cancer, how we can prevent uterine cancer, how we can diagnose uterine cancer, and what are the management of it. So keep watching. Welcome to Talk with Healthcare Heroes episode 9. I have with me Dr. Swasti, who is a senior consultant gynecology oncologist, and she's trained in laparoscopic and robotic surgeries. So she's with me to talk about uterine cancer, and the incidence of uterine cancer is increasing. So here we have Dr. Swasti to share what is uterine cancer, and let's know more about it. Welcome, Dr. Swasti.
Thank you, Nancy. And this is a very good initiative. Hello, friends. And I think the talk today will be primarily about uterine cancers. Uterus, as you know, is the womb, or it has two parts, the body and the mouth. So when we say uterine cancers, we actually mean the whole of the uterus. It's a larger term.
What exactly is like uterine cancer?
So as I said, uterus has two parts. It is comprised of a body. So the inner lining of the uterus is called as the endometrium. And when we have the cancer of the body of the uterus, that is called as an endometrial cancer. When you have the cancer of the mouth of the uterus, which is called as the cervix, it is known as cervical cancer. So in a broader term, a uterine cancer will mean an endometrial cancer as well as a cervical cancer. So either of these two would be in layman language called as a uterine cancer.
Ma'am, what are the symptoms of uterine cancer?
So this is a good question. You know, early cancers, early uterine cancers actually may not have any symptoms at all. So my request to all the women is don't wait for symptoms to happen. But what are the kind of symptoms that one should raise an alarm to? So if you have any abnormal uterine bleeding, that means if you have excessive periods, heavy periods, early periods, heavy bleeding during periods with or without passage of clots, or do you have bleeding in between two periods, or bleeding after intercourse, or bleeding after menopause, that is called as postmenopausal bleeding, these are alarming signs. When the cancer is actually advanced, you may further have weight loss, loss of appetite, pelvic pain, sometimes persistent vaginal discharge, which doesn't go away even after treatment, may be a sign of cervical cancer. But by the time sometimes these symptoms appear and women actually wake up and seek medical help, it may be too late. So my suggestion and my request and my appeal to all my women friends out there, please do not wait for symptoms to happen. Get yourself checked regularly.
What are the risk factors? Are there any risk factors to uterine cancer?
So, there was a time when only cervical cancers were very common, and now also cervical cancers are very, very common in our Indian women. And actually, we share about 27% of the world's cervical cancer burden. And every 7 to 8 minutes, one woman we are losing to cervical cancer. The thing is that the risk factors for cervical cancer are a little different from those of body of the uterine cancer, okay, or the endometrial cancers. So if we talk about risks of endometrial cancers, they are obesity, infertility, not having a child or taking some treatment for having a child. When you talk of obesity, having high meat diet, high fat diets, these can all predispose. And we typically say obese women, more than 45, 50 years of age, who are diabetic, hypertensive, these are the kind of women who will be at a higher risk. So raised BMI is a big risk factor for endometrial cancers. And when we say obese women, we say nowadays a lot of young women are seen having polycystic ovarian disease. We see a lot of girls, young girls with hormonal imbalances, and I have seen a lot of endometrial cancers happening in younger girls at 24 to 27 to 31 years of age. And that's because of a hormonal imbalance in the body, and the ovaries are not producing hormones in the right way, and that also impacts the lining of the uterus, and therefore this lining gets thickened and abnormal changes start happening. And these younger women also are more predisposed to having diabetes and endometrial cancers later in life. So this is about endometrial cancers. When we look at cervical cancers or the cancers of the mouth of the uterus, then the most important is early age of marriage. We know that in Indian society, we had a lot of, women were being married at a very younger age. So sexual initiation of activity was starting at a very young age. So early initiation of sexual activity, polygamy, that is having multiple sexual partners, not using the adequate right sexual practices, lack of condom usage, all, and the presence of human papilloma virus, which can actually be transmitted more towards by the sexual means. These are all kinds of very high risk factors. Multiparity, having a lot of children. So in the earlier days, we were seeing women having 10 children, 12 children. So more and more influence was happening at the level of the cervix, when women were having more pregnancies and deliveries, and this was certainly a high risk factor. And earlier, this cancer was seen, and now also, in a lot of low socioeconomic status. So, poor hygiene was also a very, very important factor for cervical cancer. So, more than 99% of cervical cancers are actually happening because of this virus, which I said is the HPV, or the human papilloma virus. And, this is totally a preventable cancer. So, unfortunately, our women are suffering, but I think more awareness, more information, more awareness, and leading the women to the right road, I think will prevent cervical cancers to a larger extent.
Ma'am, so what are the stages of this cancer? Like, is it same also? Endometrial and
Yes.
cervical, the stages are
Yeah.
same?
So every cancer has four stages. So just like every cancer has four stages, endometrial and cervical cancers also have four stages. So let's talk about endometrial cancers. When you have the cancer which is confined to the body of the uterus only, it is an early stage. And this is the time when these cancers, if detected, have a very, very good outcome. And more than 95 to 97% of women can have a 5-year survival rate. So we say these are almost curable cancers when they're detected early. Same with cervical cancers. If the cancers are only confined to the cervix, small tumors, so early detection is the key. So again, when you say stage 2, if the tumor goes beyond the uterus, body of the uterus, goes into the cervix, it becomes a stage 2 endometrial cancer. And if it goes to the lymph nodes, tubes, ovaries, it becomes a stage 3 endometrial cancer. Any stage 4 cancer will be like when it is spread to the rest of the body, where it started from, away from that area. So distant spread, whenever it is happening, we call it stage 4 cancers. Same with uterine and cervical cancers. Stage 4 cancers will be when they will be either in the lung, liver, or bone by the bloodstream. So cancer cells can actually travel by three ways, either direct spread. So suppose you have a cervical cancer, a stage 1 cervical cancer, once it spreads laterally, it spreads to the sides of the uterus, it becomes a stage 2 cervical cancer. Same way, it goes to the lymph nodes, it becomes a stage 3 cervical cancer. When it spreads more laterally, goes to the pelvic bone, again it is stage 3 cancer. Then stage 4 by bloodstream to the lungs, liver, and the bone. So similar sort of a picture, but the kind of spread is a slightly different in endometrial and cervical cancers.
Ma'am, how is it diagnosed?
So
What are the diagnostic procedures here?
yes. So diagnosis of any cancer is by a biopsy. And now also we face a lot of myths in people, in women and their families, when they're coming with symptoms, and when we tell them we are seeing a tumor or we are assessing a tumor, there's some problem, let's do a biopsy, let's confirm. Because unless and until you diagnose cancer, you cannot treat it. So the only confirmatory way to diagnose a cancer is by doing a biopsy. But there is a lot of myth which still exists, which people feel that if we are going to do a biopsy, we may spread cancer. So we keep telling them that if we were to spread cancer by doing a biopsy, then we would be spreading all cancers, because that is the only way we will diagnose them.
Yes.
Right. So for an endometrial cancer, the best way to diagnose is by doing a hysteroscopic biopsy. Now, what is a hysteroscope? Hysteroscope is a pencil torch-like instrument which we put in the cervix through the vagina and look inside the body of the uterus, look at the uterine cavity, and that is connected to a TV monitor. So this is called as a hysteroscopic procedure. Just like you do an endoscopy of the stomach, you do an upper GI endoscopy, same way you do a hysteroscopy of the endometrium, okay? And looking at that, we are seeing a growth, we are seeing a tumor, we can biopsy it under vision. So it is better than doing a blind DNC or a dilatation and curettage. So the best way to diagnose is by doing a hysteroscopic biopsy. In cervical cancers, if we are able to see the growth in the OPD on examination, then we can take a punch biopsy there and then. Otherwise, we may have to examine the women under anesthesia and then take a biopsy. So it is not a difficult thing. Women needn't be afraid of getting a biopsy done.
Ma'am, how can it be prevented? This
So,
uterine cancer.
yes. So when you look at cervical cancers, as I said earlier also, they are 100% preventable. So what we need is knowledge. That is right awareness. Now you must have, women must have seen in the television and in other media circles that we have a vaccine which is directed towards human papilloma virus. So this is a primary prevention. So when you vaccinate young girls, best time of vaccination is 11 to 13 years when their immune system is actually developing. And that is the best time to vaccinate the girls. At the moment, we don't have a legality for vaccination in boys in India, but of course girls. So when I said HPV also causes cervical cancer, this is the main culprit of causing cervical cancer. I stand that vaccine cannot prevent 100% cervical cancers, but it can give protection to 70% cervical cancers, right? Because we have lots of strains of the virus, and a lot of these strains, all the strains, vaccine is not available. So at the moment in India, what we have available is a quadrivalent and a bivalent 4-strain and a 2-strain vaccine, which if given can prevent this cancer to the tune of about 70%. But there are other ways also of preventing cancer. So once you vaccinated the girl at 11 to 13, then we can again go and continue to do the screening. That is secondary prevention. That means even if they don't have symptoms, like I said, early cancers may not have symptoms. So if these women, once they become sexually active or at the age of 21 years, when they don't have any symptoms, they should go for a regular test, what is called as a pap smear test. Okay, so a pap smear test and an HPV testing is done. In younger women, only a pap smear test, which is done every 3 years, and it is done in the OPD basis, no pain, not very expensive test. You can just do it without any anesthesia, and we just look at the cervix, collect some cells from the cervix and spread them on a slide or put them in a liquid and send them to the lab. The report is ready in 3 days time, and we know whether the virus is causing some abnormal cells or not. We can actually do a test for detecting the virus also. That is recommended in women over 25 years of age now. So the earlier guideline said do it over 30 years of age, but now the guideline now in just 2 months back has come, which says any woman over 25, because we are seeing younger and younger girls with different kinds of sexual practices even in our country. We should actually test for HPV at a younger age now. So over 25 years, we should do an HPV test. The absence of virus is a reassuring thing. That means there is still a lot of time. So cancer doesn't form in one day. It takes about 15 to 18 years for cervical cancers to form. So it is not a one-day situation. Once the virus will infect, it will start living in the cells in that area, and then only it will cause some changes, infection, pre-cancer, and then cancer. This is a long process, right? So
Yeah.
this is a secondary prevention.
Ma'am, like you said, it is curable. Is
Yes.
stage 4 curable?
No. So when I said it is curable, I meant only for early stages. And I said only stage 1 cancers. So the earlier you detect cancer, the better quality of life and the longer life, good quality life will be there. So we in cancer, don't talk about, we talk about intent of treatment. Is it curative intent or palliative intent? So when we say stage 4 cancer, that means cancer has already gone to various parts of the body. So our intent is not curative, our intent is palliative. That means we have to give the patient good quality of life. If there is pain, we have to reduce their pain. We have to make the patient away from the symptoms, from the difficult life that the patient is going to lead. So then we make these women comfortable, we look at their needs and care, and we have our pain and palliative unit, which looks at these families, and they are in constant touch with them, and all the needs of the women are taken care of. So the journey has to be made more comfortable, pain free, good quality, but the intent will be palliative when we are talking of a stage 4 cancer.
Ma'am, what is the management that has been taken for uterine cancer?
So if we talk of endometrial cancer, the main stay of treatment, I will say, is a surgical staging. So when we say stage, how do we come to the stage? We can do CTs, MRIs, PET CTs, but we will know the correct stage only by doing the surgery. But that is in the early, in the stage 1, 2, and 3. So even if you are seeing large lymph nodes or disease in the abdomen which is removable, it is better. That is for endometrial cancer. So in the surgery, what we do it either robotically or laparoscopically or open, depending on the situation and the condition of the patient and the stage of the disease. So in early stages, we can actually use robotic and laparoscopic technique to do the surgery. So the uterus is removed along with the tubes and ovaries, and the lymph nodes are removed, and all this is sent to our pathologist for assessment. So in the next 1 week to 8 days, we will have an assessment of how much areas are involved, how many areas are involved, is the disease gone to the lymph nodes. If the disease has gone to the lymph nodes, and if the disease has gone beyond the muscles of the uterus, if it's a high grade tumor, then we will have to give chemotherapy and radiotherapy both. So we then sit in the tumor board with our whole team of gynae disease management group system, and we have gynae cancer surgeons like myself and my other team members, and medical and radiation oncologists who give chemotherapy and radiation therapy. We look at the details of the patient, look at the kind of the tumor, the grade of the tumor, how much is the tumor size, what is the age of the patient, what is the stage of disease, and many other factors, and then decide appropriate further treatment if needed. So if we are detecting cancers in the early stage, we may not need anything apart from surgery. So that is also one advantage, that the patient has to undergo less treatment. Okay. When we are doing cervical cancers, similarly, early cancers up to stage 1B1, that means smaller tumors, early cancers, we can remove them. So we can again do a radical surgery and remove these tumors. Whether they will need radiation or not will depend again on the biopsy report and the local spread. When we have advanced tumors, then the modality of treatment for a cervical cancer will be a combination of chemotherapy and radiation. So it will be like a concurrent sort of things. You have small cycles of chemotherapy, and then you have radiation spread over 6 weeks. You have external radiation and internal radiation, and then you treat these cancers. So the point is, however much, I will again emphasize, the more you detect the cancer early, the more treatable, the more better outcome you will encounter.
Ma'am, like you said that a woman who's 25 and above can do the can be done pap smear test. So how often should they visit
Yes.
the
So
hospital?
a pap smear test between 25 to 30 years of age, between anything over 25 years of age, if you are doing a pap smear with an HPV testing, that means if you are doing a co-testing, you're doing two things together, then you need to do it after 5 years if it is normal. That means if there is no HPV, if there is no abnormality in the cells, then for 5 years, rest assured, if no symptoms arise, whatever kind of symptoms I said, if none of those symptoms are present, then you are rest assured you can do the repeat test again after 5 years. Now, the age for the vaccination, I would like to emphasize, is 9 to 26, extendable to 45, but the efficacy is best at 11 to 13. That means you should not, you should not delay your vaccinations. The efficiency of the vaccine reduces after that. Now, if you look at the kinds of cure rates in cancers, as I said, 95 to 97% in early cancers, right? So similarly, in a stage 4 cancer, it will drop down to 15 to 25%. Significant drop. Okay. In terms of pap smears, Same thing. If you are delaying your pap smears and you're doing one pap smear at 50, you will not know what you've done from 25 to 50. So regular pap smears, when do you stop doing a pap smear? At 65. If in the last 10 years your 3 pap smears are normal, then you stop. If for any reason a uterus has been removed for a lady and the biopsy report says no precancer, no cancer, then you don't need to continue the doing the pap smears. Then you need to only do a regular annual checkup.
Ma'am, so I think I'm done with the questions. What is the takeaway message that you have to tell to the woman out there?
Right. So I think lots and lots of takeaway messages. One, do not ignore your symptoms. Take priority for yourself. Okay, it's important to celebrate birthdays, it's important to celebrate anniversaries, but it's important to get your daughters and yourself vaccinated. That's very important. So take time for yourself. You are the one who's responsible for your own family. So if you are well, if you are in shape, if you're healthy, if your weight is under control, and your lifestyle is good, stress free, you will be able to take care of your family more. So just like we say, whenever your plane is crashing, right, so put your oxygen mask first, and only then can you survive, and then only you will be able to make others survive. So resuscitation, the basic key is to stay yourself alive. So that's what is my message. Eat healthy. Do not put on excessive weight. Exercise regularly. Don't miss your annual checkup. So an annual women checkup every year. That means you go for a breast check, you go for a regular gynecological examination to see if there's infection, if there's no problem. In case if you have a problem in between that 1 year, do not hesitate, do not delay, do not take over the counter medication. Go and see your gynecologist. Go and see a specialist who will guide you towards proper treatment of the infection. So sometimes infections, if they become very chronic, if they become very old, then you can get into trouble and it's difficult to treat. So take home messages, awareness, prevention by vaccination and regular pap smear and HPV testing, and do not shy away from a biopsy. If there is an abnormal pap smear and your doctor says you need a biopsy, don't be scared. Don't shy away. Accept the biopsy. Don't be scared. Fear is a big factor in cancer treatment and diagnosis. So the treatment is always available. It is available everywhere. You can get in touch with all your specialists and always follow the doctor's advice.
Thank you, Dr. Swasti, for
Thank
joining
you.
in. If you're watching us live, please like our Facebook page Medical Prep and our YouTube page YouTube Medical Prep. Thank you for joining in.
Thank you.